guys. I'm Kenya Brown, and welcome to Black Health 365. Now, May is National Stroke Awareness Month. It's a time to learn about what strokes are, how to spot them, and how to treat them. It's important to talk about strokes because they are the fifth leading cause of death in the U.S. and a major reason why some people have long term health problems. Strokes affect many people, but they have an even greater impact on the African American community. Black Americans are more likely to have strokes and are more likely to die from them than any other group. In fact, they are 50% more likely to have a stroke than other races or ethnic groups. The good news is that nearly 80% of strokes can be prevented. Joining us today to discuss the health challenges affecting African Americans is Dr. Gregory Hall, an internal medicine physician at University Hospitals who always gives it to us straight, no chaser. How you doing, Dr. Hall?
I'm feeling good. How are you?
I'm doing great. We are being aware of some of the things that are affecting us, which is knowledge is key. So let's get into it. Let's talk about strokes. What exactly is a stroke?
Well, a stroke first is not easy to explain, right? But it involves the brain, right? So every part of our body needs blood. We know that, right? And we breathe in oxygen, and then the oxygen goes into the blood, and the blood travels to all parts of the body, including my hands, my feet, my eyes, and my brain. And it does that by way of blood vessels, arteries, and veins. You've heard about that from biology, right? So if one of those arteries or veins gets blocked, and it's going to a section of the brain, then once that part of the brain can't get the blood or the oxygen, that those cells in those areas die. And when those cells die, whatever they were controlling is lost, right? So if you have a stroke on the right side of your brain, you might lose your left arm ability to move your arm or feel in your arm, right? Or your leg, or if it affects the part of your brain, the back of your brain where your balances are, you'll feel like your balance is off because of a stroke back there. So a stroke is really dead brain cells due to poor circulation, poor ability to deliver blood to the brain. I mean, that's as good as I could do.
No, that's a great explanation. Now, when you say the cells die, so you can, I guess, physically see what cells are dying based on what is being affected on your body. But when they die, do you regenerate these cells? Do we get them back?
Well, you don't. And we can look at CAT scans or MRIs and actually see this person had a stroke at this, at the end of this artery that went wherever it went. And they'll see the cells look different on a CAT scan. Dead cells look different than live cells. And so they can actually see them shrink up. And they can actually look, and I've had people, get a CAT scan. They were perfectly fine. They say, you've had strokes in the past. They're like, well, I have, but it hadn't affected anything that they necessarily needed. There wasn't a major, it was a small stroke. So it didn't affect a larger area. But like, to answer your question, when people lose the area, it goes to the area where you learn to speak. They're able to take cells and adjust other parts of the body and learn to speak again, or learn to move again, depending on how big or small, or depending on the size of the stroke.
Wow. Now, let's talk about Black Americans and stroke. How does it affect Black Americans?
Well, like everything, unfortunately, we come on and talk about it, it's disproportionately a problem, right? We have the highest rate of Black men, like myself, have the highest rate for stroke. Black women have a very high rate of stroke. If we have a stroke, we have a much higher risk for dying from a stroke. And so it's disproportionately, my grandfather had a stroke, my father had a stroke, strokes run in my family, and maybe they run in your family as
Yes.
well. And so if fruit doesn't fall far from the tree, right? And so if I know my father and grandfather had strokes, then I'm at a higher risk from a stroke compared to someone whose grandfather or grandmother had cancer or something like that. You may have a higher risk for cancer. I have a higher risk for stroke. So you can use your family history to kind of judge, what the causes was. And also, what were their habits? My father smoked, my grandfather smoked. So I know that smoking was that contributed to it to an extent. They both had high blood pressure, untreated. That contributed to it. I have high blood pressure, but mine is treated. And so, that's where we can really make a difference, because a lot, like you said in your opening, 80% of these are preventable if we just know what to do.
Now, a lot of these things, a lot of times we do think about heredity and all of that. But as you mentioned, some of us have bad habits in our families, so we're inheriting those bad habits, not necessarily the traits. Is that true?
That's absolutely true. And that's the old nature versus nurture. Is this something in your genes, or is it something that you learned? We've been laughing with my patients about bacon. I love bacon. If you don't ask me if I want bacon on my hamburger, my salad, my ice cream, the
Yes.
answer is going to be yes.
It's all good. Yes. Give me all of
Right.
it.
And where did I learn that? I learned that at home in the kitchen, right? But
Right.
it's not good. Bacon is not good for you as much as I love it, right? And so you have to do that in moderation. Whereas when I was little, maybe we didn't know that bacon was so bad. We didn't know that putting pork in greens was so bad. Now it should be turkey. So there are things that we know now that we can make differences in that will decrease our risk for a stroke.
See, Doc, something wrong with your mic, because I thought I heard you say bacon was bad. So I don't know. Something must have happened to the broadcast here. Now, I have to ask, why are Black individuals at a higher risk for a stroke?
Well, the main thing is we are at a higher risk for heart disease, right? And
Mhm.
that's because we are at a higher risk for high blood pressure, and those are all related. High blood pressure increases heart disease, which increases your risk for stroke. So the first main thing you can do, and we've talked about this before, is know what your blood pressure is. Don't wait for me to measure it. Buy
Yes.
one of those $35 machines at Target or Walmart, take it home, put it in the kitchen table, and measure everybody's blood pressure at home, calm, seated, feet on the ground, calm. What is your blood pressure? And so you know what your blood pressure is. If it's persistently high, you're at increased risk for heart attack, aneurysm, stroke, all of those things. And we have ways to bring those down without any side effects if you just kind of give it a chance. And so it's real important to know, identify who has high blood pressure, because that's the same person who has an increased risk for stroke. Controlling the high blood pressure decreases your risk for stroke.
Absolutely. And I must say that we get a lot of misinformation because there were so many years that we didn't have a lot of access to health care, but now you can know your numbers. You can go get checked out. You don't have to guess, and you don't have to listen what grandma or cousin down the street said about the blood pressure or the sugar and stuff like that. You can actually get everything checked out. And I have to say, I'm a very healthy eater, so I was very upset to find out that I was still being affected by high blood pressure. So know your numbers. Don't just assume, like, because I run or because I do this or because I do that, that it will not affect me. You have to know what's going on with your body so that you can make proper adjustments. It's very imperative.
And it's also very prevalent, right? So 3 out of 4 African Americans at age 55 have hypertension. 3 out of 4. So 1, 2, 3, that person doesn't have hypertension. So it's not because we all have terrible diets. It's a
Yes.
mixture of all this. We feel oppressed. I don't know if you, but I'm still feeling oppressed, right? In these
Yes.
United States, right?
Yes.
That drives up my blood pressure. Work life stress. Whether are the police going to stop me and kill me? All these things, I'm half joking and half serious, but
Yes.
these things all drive up your risk for your blood pressure, right? And your
Absolutely.
stress and your fight or flight response. And those things increase your risk for stroke. And so they say mindfulness, meditating. People, oh, I ain't meditate, but
You're
prayer,
right. Right.
right? All those things are a way to kind of give your body the woosah. I'll calm down. And that brings down your blood pressure, right? Your
Yes.
overall risk. But you shouldn't be surprised if you're a vegetarian and you do everything right and you have high blood pressure at age 55. You shouldn't be surprised, because that's what the statistics show. And it's everything that happens to you is not necessarily because of what you did to yourself. And I see that misconception in my patients who have diabetes. I did this to me and I can fix it, or they have high blood pressure and I did this and but that's not always true. Sometimes
Yeah.
it's something that's in your genes, or sometimes it's really an environment and you can't control your environment. And so you have to be able to help artificially control your environment with medication.
Absolutely. There's so many things. It could be other medications you're taking. It could be so many things. So you got to let go of that guilt. You got to let go of the guilt for yourself and just go ahead and find out what it is going on with you so that you can fix it and not have some of these long-term effects. Now, how can you lower your risk of having a stroke?
Well, if certainly probably the easiest number one thing is if you smoke, stop smoking. If you're around someone who smokes, make them go outside. You know what I mean? It really, this all people should not be smoking inside, and because they shouldn't be increasing your risk as well. I mean, so that's the number one thing. Nicotine causes vasoconstriction. Your vessels constrict, and your blood pressure goes up. And so, say you already have compromised blood vessels because you've got hardening of the arteries, and then you smoke a cigarette. Every cigarette increases your risk for having a stroke while you're smoking the cigarette, right? And so you really want to stop smoking. The other thing is exercise, aerobic exercise, just walking. It doesn't have to be, jogging, but just walking increases your circulation. That helps get your blood moving. It helps deliver oxygen, and that decreases your risk for stroke. So obviously, anything in excess, alcohol, drug, I've had these 70-year-old men who used to do cocaine in the 60s, right? And they
Yes.
get together, oh, let's do a line. Stroke waiting to
Yeah.
happen. And
It
they're in
ain't the
the ER
same. Yes.
with a
No
stroke.
duty.
And we're laughing. It's not funny, but it's funny. You know what I mean? It's like, how did
Yes.
your old butt think you could do cocaine? You can't. You know what I
Yes.
mean? You can't do drugs
Yes.
like you used to do in the 70s. You just can't do it. But that causes it as well. And so, things that we used to do and we didn't have a stroke, now we can't do as you get older and you have them. And so, exercise, water, knowing your blood pressure, and taking medicine if you need it. Sleep apnea. A lot of people have sleep apnea in the Black community, and that increases your blood pressure, which increases your risk for stroke. So if you could, if you were able to get treatment for that, that does it. Just a healthy lifestyle overall.
Absolutely. Don't go over to grandma house with them cousins and stuff and you 50 something now and you think you could still do all the same things that you did before because things might be a little bit different now. This is really an important part, Dr. Hall.
Hmm.
What are the stroke warning signs? What should we be looking for?
Well, here's the thing. They have this thing called Be Fast, which is an acronym for all the words. And so the B part of Be Fast is balance. And so I
Mhm.
mentioned earlier, if you have a stroke and kind of in the back of your circulation that goes to the back of your brain, that can affect your balance area. So you find out all of a sudden you wake up and you don't have a middle ear infection and you're old enough to have a stroke and you have untreated high blood pressure. Balance might be one of them. Eyes, if you have double vision, sometimes
Yes.
they, out of nowhere, that can be a sign of a stroke. Face drooping, and people say, well, I look in the mirror and half of my face, and some of that can be caused by Bell's palsy in younger people. But if you're older, you're at risk for stroke. Facial drooping on one side can do it. Arm weakness on one side, and it's usually not both. It's one-sided arm weakness, left or right. Speech difficulties, not being able to talk. Words just aren't coming out my mouth right. And then the end of Be Fast, the T of it is time to call 911. Because if you can get there in a timely fashion, they can give you some clot dissolving medicine that will dissolve the clot before all of those brain cells die. I mean,
Mhm.
just like anything, we can be short of breath and not be able to breathe, but then all of a sudden they open it up, you can breathe again. Same thing can happen in the area. If it's blocking to the cells, it takes a while for those cells to permanently die. And if they can open that blood vessel up, then the circulation can go, the oxygen can go, and those brain cells can rejuvenate. And so when people sometimes have these symptoms and they resolve, they call it a TIA, or transient ischemic attack. People say, oh, I had a TIA because I had this happen. I went to the ER and it resolved. So that's one of those things too. But you don't want to wait and see what happens. That's one of the situations you don't want to do.
Don't
You
take a
don't want
nap.
right. Don't okay. I'm gonna go back to sleep and see if my face is undrooped in 4 hours, because after that they can't reverse it, right? And
Yeah.
so it's really important that you want to do it immediately. Do not wait and see how things go, because the faster you go to the ER, the better. Most people have, crazy as it is, strokes in the morning,
Mhm.
right? And so they either wake up or their symptoms at 7 a.m. All of a sudden, I started feeling funny. That's more likely to be a stroke. If you ask people who've had stroke, what time of day was it? They'll tell you it was the morning, right? And because that's when your blood pressure is highest for some reason. Just kind of getting your head ready for the day ahead, right? So it's real important. Don't play around when you have any of these be fast symptoms. You want to be fast and get to an ER and let them know what your symptoms are, so that if they can reverse it, that'd be ideal.
Absolutely. Listen, health is wealth, y'all, and I'm so grateful to be able to talk to Dr. Hall and give you some of these conversations, because a lot of times when you go into the doctor's office, it's all business. They're trying to, find out what's going on in your life right there, but we get a chance to give it to you in a longer form, more conversational. So make sure you share this video, because it may have some information that could be helpful and could save a life. All right. And thank you so much, Dr. Hall, for joining us today and sharing information on stroke awareness. As we wrap up this segment, I encourage everyone to prioritize their health by finding a trusted primary care provider. Call 216-714 2397 to schedule an appointment today. To learn more about our Black Health 365 program, visit wzakcleveland.com/BH365. Thanks, Dr. Hall.
Thanks so much for having me.